Voice of Nagaland News se apni angi sobke sokat kure ase viewers kan Voice of Nagaland News etia Zion Hospital te ahina ase jani daga nishina 28 sal August 1 to 7 de shugile do World Breastfeeding Week annually mana ami khan honibo pare aro ami khan tikhibo pare achi yate Nagaland chapter kundu de shugile do Indian Academic Pediatrics kan pra yate ekta press conference rakhi gena ase etu laga opor do theme do shugile do tu sala do shugile do Paradise Breastfeeding Create Sustainable Support System etu laga theme laga opore yade ami khan press conference rakha tikhibo pare ase ami khan sai gena jai shugile do ekta bacha kani ama laga tu toile do kiman important ase aro etu laga opore ami khan laga community de mo khan sai gena jai shugile do pishi bak toile do kotba din de confusion aro myths khan laga opore bi olibi ama khan olibi society olibi kotba din de awareness phal no pungcha laga opore ami khan dikhibo pare ase achi yade press conference ekta rakhi gena thaka do shugile do etu breastfeeding doile do ekta ama gani kiman important ase aro etu laga opore bacha gani bi breastfeeding doile do kiman important ase takhamra moan ge highlight kuna chanai dise etu laga opore aro ami khan chanibo pare thaka do shugile do yate kotba din de misconception aro myth laga opore breastfeeding la time de bishi confusion bi olai jay yate baba khan holibi community khan holibi itu breastfeeding laga opore ami khan kina na sensitize kuri gena itu educate kuri gena awareness mohan nijor janibo lage itu la opore ta ami khan ge phal ba samjai da ami khan dikhibo parse to viewers kan ibi itu press conference la opore ami khan sai sabo.
My name is Dr. Akam and I'm the president of the Indian Academy of Pediatrics Nagaland branch, and we basically are celebrating the breastfeeding week. So breastfeeding week to mokhan every year celebrate kore aru the first week of August te mokhan celebrate kore 1st of August to the 7th of August aru itu WHO aru World Alliance for Breastfeeding Action itu pura milai gina all internationally itu celebrate kore aru in India itu Breastfeeding Promotion Network of India connect association ase so itu khan bra spearhead korina itu celebration to thake. So based on this theme, the theme this year is prioritize breastfeeding, create sustainable support system. So based on this theme, the Indian Academy of Pediatrics would want to emphasize on making breastfeeding practical and accessible. Sob ki accessible hobo lage aro we want to promote breastfeeding. Kiman breastfeeding kore iman bhal ase itu mokhan awareness ekta karone itu press meet to matia laga ase. Here we have Dr. Solantang, who is the General Secretary of the IAP Nagaland, and we have Dr. Apong here on my left. He is the Treasurer, and my colleague here, Dr. Tamjan, he is a consultant from Belhos Clinic, and we are here today to basically promote and create more awareness on breastfeeding. Well, breastfeeding is very important, and that's the reason why every year we celebrate this. Now, apart from the benefits to the baby and the mother, there is benefits to the father also. Kile gole puisa bi save hoi jay bido formula khan bi expensive thage so puisa bi save hoi dura aru family laga financial economic bi idura save hoi jay itu in environment karone bi bishi bhal ase breastfeeding to kile gole itu milk bona dam de bottles khan hobi packet khan hobi wastage khan idu packets khan aru environment dirty kura edu khan bra sob ke bachai loi so it is amma ki bi baby ki bi aru baba family society aru environment khan karne bi edu breastfeeding to bishi important ase.
Acha the breastfeeding do process of breastfeeding itself bishi important ase khali milk ekla korne noy only bi process to be important ekta ase itu baby la do mohan benefits to discuss korbole to we can discuss maybe for 2 years itu there is a special branch people who study breastfeeding khali itu kone study kora branch bi thake to lactation consultant dan thake but in short few points I want to mention itu very important points kam do ekta do it provides complete and natural nutrition as though to breast milk to baby kone do boil korle na lage you don't have to prepare especially na prepare korle na lage then to complete nutrition as tadi baby la protein requirement protein carbohydrates ki lage so milk to already ase and then not only that baby specific be act as a milk to baby ba ki lage itu la hisab ra amawa every mother produces different type of milk depending on the needs of the baby itu act as aro itu no na brain kone bi bishi important act as तो apni kan la every parent wants their child to be brilliant, and then every time academically be bhal hoi jole mon jay. So breastfeeding is one way you can help the child itu because the DHA kona ARA kona brain la nutrients itu kan sob ase itu help kore. The other point is that baby la immune system bhi itu help kore. Milk though is like first immunization dia nishna ase. Amma la immunity ki whole lifetime ki immunity develop korna ase itu baby ki bhi transfer kore through the milk. And then those kun baby breast milk bal bra khai na thake etu one to long term health kone bal diabetes kam bhi komti thakibo, allergies kam bhi komti thakibo, to baby la bhi benefit borta ase. And then when we come to the mother, amma labi, it's not only for the baby but for the mother also. It's very important because it amma ki recovery after delivery we help correct. Pain bhi kom diya wo, bleeding kam bhi kom diya wo inna se. And then not only that, ovarian cancer nishna, breast cancer nishna, ajikali to cancer to more and more so make ola nishna olai jase. To itu kan so prevent kore. Itu an na high blood pressure, heart disease, type 2 diabetes amma kone bhi itu kan so prevent kore. And then the other thing is the mother weight management kone bhi important ekta ase. The mother doesn't have to gym di jawle lage na figure maintain korle na, we don't have to do all those things. Cholesterol, triglycerides ki ane itu kam bhi reduce kore, so without any extra effort. And then the most important, the other important thing is emotional bonding ase. So many of us, many of the parents time na pai bacha khan ki dibole time na pai na take ajikali autism kan nishna no ADHD ko attention deficit kan itu one beshi hoy jaje. So one reason is that the emotional connect na take. So through the breastfeeding the emotional connect kam take. So these are the few important points, and more we can discuss also. Asol do ek bar koshule do milk to it produced from the brain in a way, because kitia baby bra suckle kore, there are many hormones which the mother generates. So itu bra detect korna, the more the baby suckle, the baby la requirement is bra aibo ina dege. So let's say that milk ama ekta baby ekta premature baby baje. So premature mane time no bongja age de baby ba han, to tahan la milk requirement do, tahan la nutrition requirement do alag lage. They require more protein to be lage. So premature milk or term milk to be ekdam composition do alag alag lage. Not only the composition, in fact daytime produce kora milk, night produce kora milk to be alag ase. That's why khali kunba do khali daytime dibo, kunba do rati je dibo ko. To itu kan sob to itu complete milk to na pai. To conditioner itu amal baby ki requirement ase itu la ama ba body ba detect korna itu la sabra produce kore. So premature baby la mother kamba do more protein produce kor korna ase.
Yes, that's a very good question. Itu baby specific mane apni ida Dr. Temjen Bravi elaborate kora nishina baby khan to jodi preterm mane time age di pai je. Ekta term baby do mon kitia bhal ra 9 mahina bukhi na thakibo itu an ki term baby after 9 months pai sigule olibi itu la age bi pai jabo pare. To inia baby khan to tai baby to baby olibi ekta bishi chotu aru bitangor baby la majuti requirement to bishi alag ho jay. Aru tan regarding breast milk, to idu an premature baby khan la amabra milk to sawoli do ki nishna dikhe olibi bitor microscopically size gele to bishi difference thake. Tahan protein bishi lage, itu kan protein composition iniga aru baby to kitia dangor hogina jabo aru few premature baby to khai na olop moina bishi taibi taila time punchili do taila amala milk to hi naturally change ho jabo. That is God's way of producing a very good nutrient for the baby, as well as morning or evening la changes bhi thake goi. Plus baby bra kitia breast milk koibo first itia ekta session ekta boina tani siguli to first ahala milk to size siguli to olop patla gorna thake, because it contains more water and more carb, whereas aste ra khai na to after 10-15 minutes of breastfeeding khai ase to the first month it give 4 milk front first agan hind milk thake. So practical implication is that कि मोहन किधर वो तो baby के वाला भी खाए ना रखी थी वो परे तो first खाएगा ना भी तो पूरा baby तो ताई निजर till ताई निजर stop न करा था breastfeeding करो लगे that is the whole point of this theoretical discussion for milk hind milk ला ಇದು theoretically इतु भी ऐसे और किधर वो तो मोहन बच्चा कान के दिन दी तो और राती कान दी convenient time दी तो formula खिला दी वो दिन दी तो आमा कान कुन वो तो खाली breastfeeding करो वो निया mix भी करी जाए but we have to remember that कि दिन दी खिला ला milk तो आमा एक तबरा आईची को लिबी milk ला composition दी difference था वो so it's also very important that morning only din only as far as possible exclusive breastfeeding that means you have to try to breastfeed your baby morning evening till 6 months tak to mon exclusive breastfeeding to it be advocate kore so this is why we say ki it is in baby specific ko to taila baby la date time age hisab de amar milk to be produce kore
अच्छा अपनी का नागलिन context से अब kan tangala bachang ge breastfeed going on where and what is the scenario
अच्छा अभी kan Nagaland लगा तो इनका statistics तो नहीं थे तो but what we feel as pediatricians we compare to the Indian national if you see the statistics it's around 63% now when do exclusive breastfeeding that is first 6 months बच्चा तो खाली दूध दिया था so in India it's around 60% in an ideal world na so bata to 6 months to the khila ko lage but itu to ije bhi hone so it's around 60% if you see in the whole world if you look at statistics by UNICEF it's around 54% but on one hand if you see na article to bishi to bata to hospital hai delivery hua se nearly 80% but breastfeeding to ite bhi kam ase on one side if you see breastfeeding is culturally acceptable na sob manu breastfeeding to if you see our tradition cultural sob accept kore but still gap to ase we wish it will be better but still there are a lot of gaps no to breastfeeding garne if you see the WHO recommend grado first 6 months to only breastfeeding but up to 2 years tak to khan khilabi na along with of course after 6 months to breastfeeding korbo alag bhatbe khilabo but up to 2 years is the recommendation you can auto barabi breastfeeding korbo par good no harm beyond 2 years also but at least don't that is the recommendation of course I think it's difficult to go into every detail but there are some medication where we will say stop for example if mother to cancer ase kole to stop korbo but if it is just a paracetamol or simple medication or antibiotic we will not stop we will continue but for that of course the doctor can give what you would like you but for most tawai khan to stop korbo na lage except be condition cancer condition na
this is one of the most important point that we need to or what we want to highlight also regarding breastfeeding so to first thing I want to say like add on to what just Dr. Salan has also answered ki tai mon kiman tak breastfeeding kuro lage kiman sal tak to exclusive breastfeeding kuna ekta kotha thake or breastfeeding that means exclusive mane jonam hua din bra the day baby is born till up to 6 months khali breast milk ekla khilabo bacha ke to pani bhi na khilabo and then food bhi ko na khilabo ama la breast milk is enough because it is a liquid diet so tadi pani bhi thake taila protein fats kan ki requirement vitamins vitamin sob pai jay so etu karone exclusively itui khilabo lage hoy bimar hoise bache to na kiba ekta hoile dawai khila to that is different or dawai kan to pani di mix kurna dibole lagi jay so that's a few ml of water which is we don't count as feed but other than that baby should ideally be breastfeed exclusively till 6 months 6 months onwards till up to 2 years tak bacha to 2 साल न हो तक तो breast milk feeding तो continue करूँगा कोई because ताई तो बच्चा तो 6 months पीछे तो मोहन ताई के complimentary feeding खाना खान food खान start करूँगा that is culturally appropriate निजर ला tradition निजर ला culture सब तो ये तो start करे और भी ये तो start करा था कि 6 months पीछे 7th month starting la din ba tage bhat khilai jule itu bra tai starting is it so you'll eat 1 or 2 spoon the baby may eat few spoon only so still breastfeeding will be breast milk will be the main food then onwards till up to 1 year pichi do aro 2 years tak tibi tai do aste aste by baby bacha ekta do mon bi jani thakibo ki bacha do 6 months ti do tai pura do nijor khai gena boi gena mon dia sob khabo na pare আৰু ইটোলা মাজতে বিমাৰ সিমাৰ বি সৰ্টি কাছি গান বেছি ওলাই তো তুই টাইম আৰু বাচ্চা নাখা হৈ যায় বিকজ till up to 2 years তো বাচ্চা গান ইটো ভাইরাল ইনফেকশন ছোট মোটো বিমার গান তো তান গ্রোইং আপ লা বিমার which we call ইটো বেছি হৈ থাকে তো ইটো টাইম তো তাই খাই থাকা বাচ্চা একটা বি এক সাল আধা বাচ্চা এক সাল অলরেডি স্টার্ট কুনা খাই থাকা বি ইকো নাখা হৈ যায় so that time on breast milk is the only sustaining nutrition so that brings us to the second misconception in our culture ki ek sal hoba bichi to breast milk stop koribi which is totally wrong because koanishna 6 months pra tai breastfeeding to continue kori ase but 6 months pra tai ge bhat kha start korichi to 6 months from 6 months to 12 months tak to bachcha ekta to bhal ra khawole nei ki na thake to idula majete apni breast milk pe stop kori dise khana bhi bhal ra na khai to usually the bachcha to till next 1 year to tai ge eku milk digena na thaki chi bole to tai struggle kora start kore to bimar adam di amala dud bhi na pae khana bhi bhal ra na khai kuchi bole to taila weight gain taila growth ti beshi effect kore so this is why it is one of the most important misconception that breastfeeding should not be stopped till up to 2 years to continue koribi beyond 2 years pe continue koribi there's no harm but by that time bacha to all grown up kuna thaki independent hoina thake so mon idu cultural shaming about exclusive breastfeeding ek sal hoche chhari dibi idura একটা কনসেপশন কি বাচ্চাকে দুধ বেশি দেরি খেলাইছে বলে তো আমা তো উইক হয়ে যায় তাই পাতলা হয়ে যায় কিন্তু দিস আর অল মিসকনসেপশন বিকজ আম্মা বরা বাচ্চাকে ব্রেস্ট ফিডিং করার আমালা হে বেনিফিট বেশি হয় হার্ম তো একটু দেখা নাই আজি তক তো দেয়ার ইজ নো সাইন্টিফিক প্রুফ এন্ড দ্যাট ইজ হোয়াট ওয়ান মিসকনসেপশন উই হ্যাভ another misconception is that amado breast pala din to baby is born amado milk to bishi bishi ayo lage all of hanai guli to itu to amado milk comti hoijibo na amagi pressure dia start kori ki I do khabi breast milk aibo but in the first few days after babies is born the mother will produce something what is called a colostrum to itu colostrum milk to be itu normal milk nishna noy it's a very thick and then very rich in proteins and all these immunoglobulins fats kan thagaba aro it will be produced only in few ml 5-10 ml nishna thage which is sufficient for the baby mon babu ki itu 5-10 ml likla iman drop yo lai baby to pet pota no hobo but it is not like that because it's quite energy dense so itu kan aro aste or especially first timer ekta ama ekta hoichi goli to tando experience mi nai aro tangala pressure beshi thake or especially if is cesarean guna delivery bi beshi hoy jay so itu bichi to tangala idu milk produce korli it becomes quite challenging so this is not a fact that they should produce more milk aste ba hoy jabo we have to be very patient and considerate to the mother also another thing is that formula milk to na mon powder la milk kan ajikali lactogen kan ki bishi powder so mano jane so idu kan to kha to breast milk to bhalo la jiguna kinoba to misconception thake ki monla bachcha to ida mon to ekbar bi tage tinala powder la dud khila na ta to lo weak ho na ye so mano bi dud khila ase to kipek ta bhalo ho na yona misconception thake of course formula milk to biya la kotha ko ane but breast milk na punche na thagi jay or first struggling mother than the mon kitaba the formula milk to be chola boli lai jay but this is not better than breast milk so that is another misconception but definitely amala dud na pai or option nai na guru la dud khan khela start kore to idula the formula milk to bhalo la ase because cow's milk is not made for human baby especially in the first few months after birth so it is like counterproductive ho jay another big misconception is that ki ama gandu ekta ama hoche bhagon bra apni ki baby diwole la opportunity dise breast feeding to kuri pariboi lage ene bi concept consider kora pressure dia start kore ki ama baba and grandmothers kan do especially koina ki mohan to bacha kan 10 ta 20 ta mane 5 ta 6 ta family dangor panai che le mohan to sab ki breastfeeding kore ase ajikali la maiki ando to ando lo kiba kumjor ase breast milk no like no pressure bi thake but it is not true ki it is a natural process but it is not like a fact that all the mother whoever are giving birth should be breastfeeding breast milk to I will like because it is a nature but there are certain techniques certain ways to counseling can be divo lage na we are living in a world where even special lactation consultant can be thage jay so before delivery be after delivery and then breastfeeding ki support rule to doctor kan olibi nurses kan olibi and even general public awareness kan thagili to it goes a long way in helping the mother to start breastfeeding but without pressure and then another one thing is that ki mon ekta do breastfeeding la do idu dawai khala do arbi apni kan hutia do just more clarify ki idu bi ekta misconception ase ki ama gan bacha gan do bimar hoisigule ama an ki khabo lage That's another very important question. Ki bacha bukhar otise gole to ama breastfeeding kurabra taira mangso khabra nolibi itu khaise itu kurabra baby to bukhar bishi uthi ase to nolibi jaundice olaise gole to ama ekta chicken kha kiba kibi khabra itu ba inia hoise to gona. There's no scientific proof, and in fact it is not true, because these are just cultural mohan nijor la Naga culture or Assamese culture or Hindu culture, like Western culture nijor la culturally appropriate inika taboo khan thake. But this is not the truth. Because why we stress so much on this is because bacha bimar adam de ama to already she is very conscious and very deep mane mon chuto gena phui lage na thake worried thake to itu la opore apni itu khabra apni la bacha bimar it produces so much emotional guilt in the mother that itu ra breastfeeding itu impediment hoy. So this misconception should also be like a very big, we should need to fight by creating awareness. So these are the few misconceptions that we face commonly in day-to-day practice. Yes, definitely. Unless there is some medical doctor, which is quite rare, okay? But there are conditions which we will tell specifically to the mother, these are the things you should not eat because you are breastfeeding your baby. Even medicine also, most of the medicine that doctors write are breastfeed. If it's a good doctor, TikTok doctor, breastfeeding then he will not write that medicine. So means the doctor, so it's usually safe. Another one thing, sorry, taking too long time, but baby bimar hua time de bukhar uthise kuli to ama to breastfeeding kuri ase to ama ki paracetamol khilai na itu ra baby ki tawai to breastfeed pra jai na baby bhal hobo. That is also another big misconception. Just like ama to bimar hoina taila treatment ra bacha ki harm nakribo breastfeeding kuri because breastfeeding de ama la antibiotic ki tawai khadon na jabo. It's a safe drug most of the time. Likewise, baby bukhar ase amar ba paracetamol khaina tagi breastfeeding guli itubra baby ke paracetamol do breast milk ra jaina help kore. This is also another, that's why baby to bhali noy to serious bhi hoigena bhi pai jay. So this is another misconception.
Panishna 6 months tak to amala duthi dibo lage hoile bi in that process. See, mother ekta ama ekta kitia deliver kore itu ama bi man tired hoina thake, cesarean hobi ki normal delivery hobi, they are tired aru ta khan bi stress te thake, physical ekla noi mental stress bhi ho jay. On top of that tai khan support system bhalwa na paile to problem bishi holai jay. Kili gole this year mokhan la theme to ki ase gole the create sustainable support system. So itu support system to kun ase gole the mokhan sob ase, society ase, family ase, relatives ase, neighbors ase. So itu karone itu support system dibole do mokhan sob la responsibility ase. Instead of discouraging the mother ge itu nukuribi itu ki mana kura bora do mother ge encourage korina paribo de breastfeeding paribo de guna encourage kora bora takhan la stress release hoi jay. Kitia stress release hobo, breast milk produce kura la hormones increase hoi jay aru itu bra breast milk flow do increase hoi jay. Edu karone ama kan kitia deliver hoy takhan actually itu counseling do delivery kura laga age bora start hobo lage. Pregnant thaka time de bora takhan counseling start koribo lage, breastfeeding kina koribo, baby ki kina dhoribo, itu kan to start kuri kina thakibo lage. Many times mokhan Nagaland de itu practice to iman do nai hoile bi mokhan itu bi catch up koribo lage aru hikibo lage. Aru once deliver kura piche de mother laga support to bishi dibo lage, relatives kan specially. Aru itu bura mother ke bishi boost up hoi jay, tala mental strength aru physical strength bhi boost up hoi jay. Aru kwa sati khan bura kwa nishina khalwa de eku inika alak mana eku nai. Aru mokhan janibole laga do itu bacha khan do baby khan do kali porson ta khan mokhan la citizens khan hobole ase, naga manu khan la future ase, India la future ase. Ta khan ki breast milk dia bura ta khan la IQ increase hoy. Itu to ekdom proven fact ase. There have been lots of studies. Breast milk ekla khabra IQ kiman increase hoy itu sob documented ase. Itu karone kiman mokhan la bacha khan, mokhan la society la bacha khan IQ bari jay, strength, immunity bari jay, iman mokhan la country, mokhan la state develop hogina jabo, advance hobo. Itu karone itu mokhan la future leaders, future citizens khan ge kinaka kora mokhan ra bhal wala takhan ge breastfeed digina best nutrition dibo itu mokhan sob la responsibility as parents, as relatives and as a society. Therefore itu platform bora moi ko mon ja do breast milk to sabse best ase aru itu awareness to bishi important ase sob society karne.
Can mothers infected with HIV/AIDS can feed their child? Can breastfeed the child?
Nako, National AIDS Control it umbar to koy you can breastfeed, but only one thing is that mixed feeding na takule lage. either it should be exclusively breastfeeding or exclusively formula. So দুইটা তো মিক্স নকৰিলে লাগে because with mixed feeding there are more risks baby ki spread হ'বলৈ with chances.
Yeah, just to add to that, for that, the mummy though should be on treatment, nah? We
Medication.
to tawai khai thakabo lage.
HIV la dawai.
HIV la tawai, nah? Then of course, then baby also we give medication. If that is there, and we will mummy laga HIV to control asna da yan sai thakebo. Control ase kole do, if not control, then it's not advised. But if mummy la HIV do treatment hoy na control ase kole do, if you see the latest guidelines of NACO, National AIDS. So we look at the number of virus in the mother's blood, no?
Viral load.
Virus to come ase kole do, yes, it is advised.
The best is undetectable hoile bhal. Mother laga blood te undetectable hoile do it is very almost safe ase. So on top of that baby ki bi kunba dawai dibole olai jai. So itu prophylaxis bi koi mo khane na, so that the baby does not get the infection. So overall in India or African countries this saise gole do prevalence to olop to high ase. আৰু মোখান লা poor condition financially economically মোখান অলপ poor আছে এইটো কাৰণে ব্ৰেষ্ট ফিডিং তো মোখান দিবলে তো বেছি মন কি গলে ব্ৰেষ্ট ফিডিং তো নিদিলে তো এইটো আম্মা বাবা তো economically poor আছে বেবি কি খিলাবলে একো নাই এইটো কাৰণে মোখান ব্ৰেষ্ট ফিডিং তো খিলাবলে মন but for that it would be better and best if the mother has already taken the ART or the treatment for HIV properly ইনে হইছে গলে তো ভাইরাস তো আমালা দুতে ওলাবলে চান্স বেছি কম হৈ যায় less than 1% বি কব পাৰিব এইটো কাৰণে undetectable hoise gole the almost 100% chance that the baby is not going to get the HIV from the mother.
To add on to that, no, so ultimately though it is theoretical discussion is now, but for practical purpose, simply first thing though apni HIV asna na idu janewo lage amado to idu garne antenatal checkup korna ekta kotha thake ki bishi wala to achanak pro apni kite bi checkup kora nai bacha bukhina aji delivery kula jena hospital ra pain uthina aise goli to idu time to hospital aise goli to screening to kore holibi jodi apni age pra 3 mahina 4 mahina age pra apni pregnant howa piche tik tak checkup korna tik tak jaga di jaise goli to government se hobi private sector de hobi idu kan blood test kan sob ready korna thake तो जानी इदु टाइम दे आगे बरा बच्चा बुखिना फर्स्ट 3 मंथ्स दे डिटेक्ट करना थाकिसे बोली तो ART को ट्रीटमेंट स्टार्ट करना थाकिबो तो इदु टाइम दे ART सेंटर बरा अपनी हला डॉक्टर खान कुन का नर्स खान बरा साहेब फाल बरा गाइड करबो सो इट इज वेरी इंपोर्टेंट दैट जगेना आमा प्रेग्नेंट आमा सब तो स्क्रीनिंग करो लाइक फॉर ईच प्रेगनेंसी लास्ट टाइम ना थाकिसली दिस टाइम तो ना थाकिबो ना भी को गारंटी নাই सो जगेना करिबी देन इदु बिचिदि दो अपनी एक बार डिटेक्ट करिना इदु ट्रीटमेंट स्टार्ट करिसली तो हैंड होल्डिंग करबो till अपनी डिलीवरी ला आगे बरा अपनी की दवाई खाबो लागे बेबी की भी आफ्टर डिलीवरी किना हैंडल करले सब भालबरा बुझाइ दे सो इदु प्रैक्टिकली फॉर मदर्स দিব পাৰে না দিব পাৰে তো ইমান কনফিউজন বি নহয় হলি বি বেস্ট তো আপনি গান গানি ইনিকা জায়গা কিবা দে চাইলে ভাল বিকজ নাগালেণ্ড ইজ দ্য সেকেন্ড মোস্ট highest prevalence in all over India. Nagaland after Mizoram, Nagaland is the highest HIV prevalence state. So these are very important questions that you asked. Thank you so much.